Hello everyone, I'm Dr. Divya Sharma. I'm a dermatologist with special interest in trichology, cosmetology and pediatric dermatology, and I practice in my center in AECS layout, Bangalore. What is urticaria? 5 things to know about urticaria. Number 1, urticaria is appearance of tender red swellings which is known as hives. Number 2, it is acute if it lasts less than 6 weeks, and it is chronic if it lasts more than 6 weeks. Number 3, urticaria can have varying causes. In some patients, it comes after pressure. In some patients, it can come if the core temperature of the body is more. In some patients, it can come in when they come in contact with something cold. It can also sometimes happen due to worm infestation. It could also rarely be a sign of atopy. It could also happen after suffering from a throat infection or a diarrhea. Number 4, it could be idiopathic or without reason in around 40% of the patients. Such patients might require some advanced testing to rule out autoimmune causes as well. Number 5, urticaria is definitely something which is not dangerous. The symptoms can be very well controlled with the right medication. Patients often panic thinking that they are suffering from some unknown allergy, which is not true. In patients where urticaria is idiopathic, it does not necessarily mean that you are sick or you're going to get sick with something unknown or much more grievous. Urticaria is just a contemporary of allergic rhinitis or a sneezing or a wheezing, the symptoms of which can come under control, and over a period of time this can be managed effectively, and we have seen many patients recovering from urticaria very well. Please consult your dermatologist if you are suffering from hives. 5 commonly asked questions about urticaria. Number 1, is it dangerous? No. Urticaria does look dangerous, but is definitely not dangerous, especially if your basic workup has come out to be normal. Number 2, does urticaria leave scars? Urticaria lesions or hives generally resolve within a couple of hours, leaving behind no scars or any trace of the rashes. Number 3, what are the common triggers, doctor, which I need to avoid? You need to avoid cigarette smoking, alcohol, painkillers, stress. But not every patient requires to eliminate peanuts or nuts from their diet. It is a misnomer that all patients, if you have been eating those food items earlier with no problem, there is no reason to believe that now they could have triggered urticaria. Number 4, doctor, am I ever going to get rid of these problem of hives? Yes, my dear, urticaria can very well be treated, and over a period of time, the symptoms definitely come under control. Do not panic or stress over urticaria. Number 5, do I need to restrict certain food items in my diet? As I said, elimination diet is not required for every patient. But if you only get hives after eating a particular food item and not unless otherwise, there is no reason for you to believe that you've developed a food allergy. Food allergies are not so common in an adolescent or adult age group. They're generally more common in the first year of life. Please consult your dermatologist today to get away from the anxiety and fear of urticaria. It is something that can be easily managed or controlled. Thank you.